science major this fall this fall. And then I've been working as a lead product engineer at DFX, and my research has been at the intersection of medicine and artificial intelligence, and that is why I am here speaking for you today. So I hope that after you leave the session today, you have a sort of overview of what artificial intelligence is, how you can use it in your workflow, and why it is so important in the field of healthcare. So without further ado, I'm going to share my screen. Just give me like a thumbs up if you can see my screen, and then we will get started. Can you see my screen? Okay, perfect. Okay. I'm going to be covering the foundations, like I previously mentioned, for how to use AI in medicine in any field that you come from. And again, hopefully, when you leave the session today, you will have stuff that you can do moving forward. Right. So you must have heard of this phrase, no matter what field you're coming from, AI will not replace field. Field who use AI will replace those who don't, right? And the reason that you see this, you hear this a lot, is because AI is a machine and it isn't something that can operate on its own. It is something that you need to operate with, and your skillfulness essentially depends on your ability to leverage artificial intelligence in your work, right? So AI will not be replacing doctors anytime soon because being a doctor doesn't really entirely just depend on pattern recognition. It has so many other factors, including emotional intelligence, establishing a relationship with your patient, as well as symptoms that you're visually able to see in your patient. There's so many things that go into being a doctor. So it isn't something that AI will fully replace, but AI is definitely a really, really helpful and powerful tool that you can use and integrate into your workflows and become a better a doctor with the help of it, no matter what stage you are at in your career, right? So you must have heard of these three terms. These are like buzzwords that you must have heard over the past 3 years, over the past 6 years. Sorry, if you have a question, just go ahead and raise your hand or drop it in the chat. I will make sure to have an eye on the chat as well as if anybody has their hands raised, because I want to make sure that this is an interactive learning experience for you. Uh, Yes. Okay. So there are three different terms that are interrelated in a sense, but they're also different from one another. We have artificial intelligence, which is the broader range. Then we have machine learning, which is a subset, and then deep learning, which is an even smaller subset. So what do you think might be the difference between the three? Any guesses on what the three mean? Actually, skip that. What do you think is, have you ever heard of deep learning before? Leave a one in the chat if you have heard of deep learning before and a zero if you haven't. Yep. Okay, so I'm seeing a lot of zeros. And again, it doesn't really mean that you're behind in any way. Deep learning is a more niche of a term, and I think that it is something that isn't as broadly mentioned as artificial intelligence and machine learning. You might have probably not even heard of machine learning before. So what exactly is the difference between the three? Artificial intelligence is the broader umbrella. Look at it as the entire realm of basically replicating a human brain. Since the start of time, human beings have been trying to advance as much as they possibly can. And then from there, artificial intelligence is when humans really started wanting to use machines and replicate the human brain. So think creating the neurons, the synapses, and the interconnections between the neurons and the human decision making. They're just trying to replicate it. So artificial intelligence, with its name, it already tells you it is something that is trying to implicate, sort of interpret intelligence. It's not something that is real intelligence. It is artificial. It is termed artificial intelligence for a reason. You have the proper intelligence, and this is what it's trying to replicate. So this is just a broader range, and then we have the subset known as machine learning, and this is when basically you're training systems on data. So a machine learning model is basically, just as the name would suggest, you're teaching a machine how to learn. Previously, what we used to do is we used to create a very large set of rules, and we used to feed it to the machine and tell it to, in order to help it understand understand what to do. But now, as time has went on and as technology has advanced, we've basically the machine has gathered this capability of learning instead of having to be told explicit rules. And that is the same way you and I act, right? We have been learning since the time of our birth. Then we have deep learning, which is a smaller subset of machine learning. And this is basically more structured, and this is a layered set of neural networks. And this is what powers medical AI tools, because it goes through those that entire layers of decision making. And this is a very, very important subset. And this is where medical AI tools really come into play. So if you wanted to visualize it, I would visualize it like this. We have artificial intelligence. Like I said, it's the broader umbrella under which everything else falls. And then within that, we have machine learning, which is a smaller subset. And then within that, we have deep learning. And then within that, we have generative AI, which is something that you might have been exposed to over the past couple of years. This is the type of artificial intelligence which is capable of generating stuff. So you might have generated images, you might have generated videos even. And then from there, you might have generated text, essays, um, maybe even timetables for yourself, for your study schedules, stuff like that. So that is generative AI. This is what ChatGPT, this is what Claude, Gemini, all of these models are essentially a form of generative artificial intelligence. Any questions so far? Yeah, this is exactly what it is, Benedict. Really good answer. Any questions so far? Thumbs up if you don't have any questions. You didn't get the deep learning part. Perfect. We can go back and we can try to understand it. Machine learning, like I said, it is when you imagine this is a model, right? This is your machine. And basically what you're doing is you're giving it a bunch of data. And then from there, it is understanding the data on its own. You're not giving it any sort of context. Deep learning is when it becomes layered and it becomes very detailed, when it starts to understand images, when it starts to understand large and large sums of data in layers. That is what deep learning is. Gen AI. Gen AI is generative AI. This is artificial intelligence that is capable of generating new stuff. So early on, we didn't have something that was capable of generating essays. By 2020, that is when ChatGPT 4 really took over the world, and that is when it was primarily used for writing essays for students. So that is the type of artificial intelligence which is capable of generating new content. Now, it's not inherently new, it's just following patterns of essays that it might have read, it might have been trained on, as well as other data that had been fed to it. And that is how it is learning from those patterns, and then it generates from it. It's not generating new content, it's just based off of those patterns, replicating those patterns. The systems and models, are they software and hardware, or they can be, or can they can be both? Yeah. So machine learning is primarily software. This is when you train a model, so it exists within your computer. So it isn't exactly hardware. It is just software that you're training on your laptop. Can you express it on deep learning again? Deep learning, I will go ahead and move to the next slide because I feel like this is going to be a much better explanation of deep learning. Actually, the slide after this. So first, I wanted to sort of give you an overview of artificial intelligence. Most people think, and most people are aware of this timeline, the post-2020 timeline, when ChatGPT really started taking the boom. And then we had models like DeepSeek and Claude, Gemini, all of these models that really came into play. But artificial intelligence is something that has been going on since almost a century ago. And basically, this is when they started trying to replicate, again, the human brain. You already have this, so it isn't better than you in any capacity yet, and nor will it be, because it is merely a replication of pattern recognition. And this is going to be a better example, in my opinion, for understanding deep learning. Okay. Right. So these are two images of chest X-rays that you have right in front of you. The one on the left is a patient that had pneumonia, and the one on the right is a patient that did not have pneumonia. So for a non-medical person like me, I cannot tell the difference between the two. But how exactly you train a machine or a model, the way you do it is you give it data. So I'll give it a bunch of images of patients or like chest X-rays that had pneumonia, and I'm going to tell it that all of these images are of patients that did have pneumonia. And then I'm going to give it another set of images, and I'm going to tell it that this is the chest X-ray of a normal person, a person that did not have pneumonia. So in this way, instead of having to tell artificial intelligence that so and so are the symptoms of this, and this is what will appear on a chest X-ray, instead of doing all of that, I can basically just give it two categories of images, and then from there, I will go ahead and it will go ahead and understand the patterns that exist in between those images itself. And that is what we call deep learning. It is able to understand data connections, understand the symptoms that exist within the patients with pneumonia by itself. I don't have to tell it I don't have to tell the machine what the patterns are. It will go ahead and interpret it itself with the whole process of trial and error. So it's going to go through a training process, and then after that, it's going to come back. It's going to go ahead and check whether it is correct or not, and then from there, it'll be able to go ahead and train depending on how good the accuracy was. Any questions so far? Does it make sense? Because I thought that this would be a better example for you to understand because it is in more of the medical terms. Timeline chat, of course, I will go back on the timeline. This is 1940. This is when the first artificial neuron basically came into existence. That's when they started trying to create or replicate the human brain. Then we have this whole timeline. The one that is most important for us, the advent of generative AI, is around 2020. This is when GPT-3 came into being. And then from there, it has gotten to the point where you see it today. Perfect. Okay, I'm really happy that you guys are understanding. Again, I thought that this would be a really a good example for you, given that you are coming from the medical field. So we have the patient with the pneumonia. Once again, this is what we call labeled data. So over here, we already have doctors that have prescribed the patient or the X-ray as a person with pneumonia or a person without. So we already know what it is. But in order to teach the machine, we're giving it labels. And that is basically what is helping the machine learn. So a bit of key vocabularies that you're going to see. Okay. A bit of common vocabulary that you're going to come across is as follows. I'm going to go through it one by one, and then we can go ahead and reflect on any questions if you have any. Right? The two images are the same, no difference. Yeah, to me as well, but apparently those are X-rays of a person with pneumonia, and then, right. So label data is the same as supervised data. Yes, supervised data is another term for label data, and this is what we call supervised learning. And supervised learning is basically when you teach it while holding its hand. You're telling it that this is so and so, and this other thing is so and so. So that is what we call, as Selena pointed out very correctly, that is what we call supervised learning. That's when we're telling the model what it is that the image represents. First thing we have in a model, there are three stages in the creation of a model. The first is a training stage. The training stage is basically when you give it the data. Like we discussed how we will give the machine X-rays of, say, a person with pneumonia and then a person without pneumonia, right? So that is basically us going through that training stage. We're going ahead and we're telling it, or we're trying to teach it, what are the patterns that coexist between the two categories. So that is our training phase. Then we have the validating phase. The validating phase is basically when we check how the model performs. So we'll test it, we'll check how well it learns, but this is all during the creation of the model. So this isn't exactly, this is while we're creating the model. We have the model after creation, and then we have it before creation. So during the creation, we're basically training it and validating it. And then after the validation, we will go ahead and test it. So that is basically what our training data means and what validation is. And inference is basically what I just mentioned as testing data. Then we have parameters. Now, like you and myself, we learn through trial and error. What machine learning models do is basically they adjust their internal parameters. So the more information it is fed, the more it will adjust its parameters. And then after that, after its parameters are adjusted, it will go through the entire testing phase again to check how well it performs. And then it will go ahead and adjust the parameters accordingly. So the parameters are basically its learning and its adjustment according to the data that it's learning. Then we have overfitting. Now, if I were to give an example for what overfitting means, Imagine you have a test tomorrow, and then right now you get from somewhere you get the questions of all of the tests that you're going to get. Of course, if you have all of the questions already for the tests that you're going to be taking tomorrow, then of course you're going to go ahead and practice according to those questions. And then tomorrow, when you go in and take your test, you're going to score likely 100% or a very good score that you're going to get, right? And the reason is because you already saw the data beforehand. And because you already saw the data beforehand, it wasn't a true test of your knowledge. It didn't really test whether you learned the material, rather, it just tested the questions that you already knew were going to come. So that is the same way that a model acts when it's overfitted. That is when it memorizes the training set and then it is tested accidentally. Maybe sometimes it's accidental, sometimes it's intentional, but usually it's tested accidentally with the training set and it gets a perfect score or really, really good score because it's learning the patterns, it's memorizing the training data set instead of actually learning from the images. So that's what we call overfitting. Again, rushing through validation and inference. Validation is throughout the period of the training of the model, we test it briefly towards the end to understand how good our model is. And then after that, after we have our complete model and we have it trained, then we will go ahead and test it on a new patient case in order to understand whether or not our model is capable of performing well on external data. I know this was a mouthful, but any questions so far? Okay, we have our doctor here telling us the difference between the two X-rays. Perfect. Creating an error. Can you please lower this fall under? Fall under. I'm not sure what you're referring to. Yes, Melindwa.
So I would like to ask whether is there a difference between the testing set, training set, and the development set? Are they the same or they are different?
The training set, the validation set, and inference or like the testing set, they're all different pieces of data. The training set is going to be primarily labeled data, like we discussed. So this is going to be supervised learning. We're teaching it because it's in the process of teaching. It's going to have labels, and then we're validating it. Validating, it's going to be the data of the same nature, but it's going to be a different data that the model has never seen before in order to actually test its limits. So that data will not have the label. So I'm going to show it a picture of a chest x-ray and I'm going to ask it, do you think that this is a patient with pneumonia or do you think this is a patient that did not have pneumonia? So that it will be the validation. And then when we know that our model is performing really, really well, we're going to close that model up and we're going to use that trained model on external sources where we can actually start using it in real world scenarios and test its true limits. And again, the training data is going to be the only one with labels because this is the learning stage. The validation data and the testing data, these both are going to be unlabeled, and it is going to be the model's job to predict whether it belongs to one label or the other. Can you diversify? If by diversify you mean give it like a variety of information, yes, you can do that with an AI. And then so after inference, you test parameters. We don't test the parameters. The parameters are something that are auto-adjusted by the artificial intelligence model. It is capable of learning from its own trial and error, and it will adjust the weights or the parameters accordingly. I hope that answers it. Any more questions so far? Better to use TensorFlow. I am not going to focus on scikit-learn and TensorFlow because it might get a bit confusing. But great question, and I can tell that you have. So how much can the training data take? How much can the training data take? If you're asking how much training data that we should give into an AI model, the more training data that we have, the better. So if we have a whole bunch of X-rays for both of the categories, it's going to be much, much better as compared to if we have a fewer set of training data because there will be more data for the AI to understand patterns from the categories, if that makes sense. make parameter, or do we set them for it? No, the model usually, you can also control the parameters in certain cases, but this is something that the model adjusts by itself. Moving on. Again, I want to emphasize on this. I don't know where these marks are coming from. I'm going to go ahead and get rid of them. There we go. So AI does not think. I think this is very, very important when it comes to sort of understanding the limitations of AI. And it is that AI does not think. AI does not think like you and I do, and it does not have pattern recognition. The only thing it has is pattern recognition, but it does not have emotional intelligence as well as context clues, social cues. There's a lot of other things that go into being a really good doctor that AI is not capable of having. So AI does not think. It is only going to recognize patterns and it can confidently be wrong. So you should always, always, always fact check the information that you get from AI because, again, it is something that can very, very easily be very, very wrong. And that is why it is called artificial intelligence in a sense. Any rule of thumb to avoid overfitting? Usually, overfitting is caused when you are training it on a particular set of data and you're taking some of that data and you're testing it or validating it using the same data. So it is usually a matter of data leakage. So you're training it on a certain data, so it already knows what it is, and then you're going ahead and testing it on the same. And basically, what it does is it causes leaking because the model has already seen it. It will essentially know exactly what it is, and you will probably have to adjust the parameters if you want to avoid overfitting as well. Training data can be different bulky data, right? So this will usually be, this can be image data, this can be textual data, this can be bulky data, any of the sorts. Model hardware or software. This is a software, and with your example, radiology, radiologists will soon be replaced with time. This is a very good question, observation, I would say. But you need to understand that radiologists don't just deal with very common sort of diseases. You need to understand that AI is, like I mentioned before, it is something that can really perform really, really well when it has trained on very, very large sums of data. If we have a disease, if we have a rare disease that AI has never seen before, or if we have a disease where we don't have as much data accumulated, like X-rays or PET scans or CT scans, we don't have enough of that data available for that particular disease. It is something that radiologists would have to still come in because they are better capable of understanding that data. So I hope you understand that an AI model is only as good as the amount of training data that is available to it. So for in instances where we don't have enough training data or enough data for rare diseases, AI cannot outperform an average radiologist. So again, radiologists will not be replaced. Medical doctors used for accurate assistance or interference. I think most of what I've seen is that doctors are very hesitant to use artificial intelligence because of the nature of it. Artificial intelligence is used to take an input. Usually the models that you use today, they take an input and they give you an output. There's a black box in between, the reasoning hole that you don't get access to. That's why a lot of the research that you'll come across in regards to AI for medicine is something that is very focused on explainable AI. So for models that are targeted or they want to be catered towards doctors, it'll have an explainable AI built into it, where it'll basically explain why it reached the decision that it did. So it really just depends on you, what model you want to use, and we'll discuss one towards the end of this. What are examples of these models used to train data? Model is basically a software, and this is basically there's different models that exist. We have different decision trees. We have a bunch of different types of models that can be used to train data. And how is the AI validated for medical use? For medical use, it is, again, it goes through the validation phase of using unlabeled data, and then from there, it is deployed in smaller settings to check whether it really performs well. But again, this is something that hasn't been largely deployed because of how doctors are really skeptical of using artificial intelligence in their workflows. Like I said, to overcome that, we're starting to lean our research more towards explainable AI to make sure that the doctor can see the reasoning that goes on behind all of this. Yeah, it's very impactful, but don't you think it will be laziness is basically in your hands? And I think that I have become very lazy in my profession because of how convenient AI is. But it really just depends on you, and it really depends on how much control you allow for it to take over. So if you were to take my advice, I would definitely say that don't use it for any sort of not any sort of learning purposes, but any sort of solving purposes. Try to sit through problems yourself, just as I try to do. And it really just depends on how you decide to use it. Do you decide to use it as a replacement for your cognitive ability as a whole, or do you just use it to leverage its capabilities to help complete repetitive tasks that you have in your day-to-day lives instead of letting it take over your entire cognitive ability? And then again, like somebody just mentioned, radiology is a leading sector where AI is having the most impact. And there was a recent news outbreak where 14 different conditions were detected from a CT scan. Again, I have the link over here for when you get the deck afterwards. But in particularly in breast cancer screening, like I mentioned before, when we have large amounts of data in a specific field and of a specific disease, that is when AI is going to be able to perform the best because it has that large amount of data to be trained on, and it's really going to impact the quality of the artificial intelligence model. And again, this will sort of outline the landscape for you. So if you are so if you're dealing with a disease that is very well researched, that we have a lot of data for, that we have a lot of imagery for, that is definitely a place where AI can really help. But if it is something that is rare, again, it is something that you would have to bring a professional radiologist in for, and a doctor that would have to take care of all of these things because AI is not capable of understanding those specific diseases in a sense. So again, reflecting on our interpretation, AI will on majority of the times when on narrow data rich will define tasks, and data rich is very important. So again, the more amount of data that we have on a particular subject, the better the AI model will be able to perform. And then clinicians still dominate on rare disease recognition, patient context, uncertainty, and judgment. So patient context is something that is really important because again, like I mentioned in the beginning, diagnosis isn't something that is done standalone on pattern recognition. It also depends on a bunch of external factors, the medical history, the family background, as well as, you know, the family history as well. So all of these things really play a part when a doctor is performing diagnosis. And because of that, AI is not going to be able to perform well in those realms because it isn't very economically feasible to have all of that data stored in AI. So a doctor would definitely need to be doing all of that work. Is the use of AI not bring redundancy in workplace? Yes, exactly. So all of the redundant tasks that you have, all of the tasks that you have that are very repetitive are basically ones that AI will be able to help you replace. The black box you mentioned, there's where the reasoning happened. Yeah, a black box isn't exactly something, but a black box is a concept that whenever an AI model takes an input and gives you an output, you aren't able to see the reasoning. So if I say to tell me whether this patient will have pneumonia or not, and the AI says that yes, it will have pneumonia, or he or she will have pneumonia, why is it that the AI came to that conclusion? So that sort of covering of that reasoning as well, we call a black box, and that is why we have explainable AI coming more into being, because we want to be able to trace through the reasoning steps that the AI took in order to better judge why the AI acted the way it did. Right. So how many of you guys have used Claude before? Claude AI. With a show of hands. Just raise your hand if you've used Claude AI before. I've seen like a lot of people, they aren't familiar with Claude, and it's really funny to me because it's like my entire work is centered around Claude AI. Even people like my family members, even though I use it like pretty much all the time, they weren't familiar with what Claude is. But the parent company of Claude is Anthropic, and this is a chart that they released earlier this year, and they basically said that this is the theoretical capability. The key word here is theoretical capability. And this is basically completely in theory. This isn't something that we can prove in any way. So this is the theoretical capability of how much AI can automate in each of these fields. Now, this isn't to scare you in any capacity, because again, if this were scary, it would scare me first. I'm a computer science major, and this is what it estimates to be the automation in my field. But again, you need to have confidence in your capability, and artificial intelligence is something that can never, ever replicate human intelligence. So you really need to have faith in yourself for that. But as you can see in healthcare practitioners, the boundary is pretty low, and the expected outcome will largely just cover admin, repetitive tasks, and again, imagery or computer vision, where we have large sums of data. And I don't think it will be this high, because I don't think any rational person would ever trust a artificial intelligence model over a clinician or a doctor with years and years of experience. So it's really important to keep that in mind when you face anxiety and stuff like that. And there we go. Right. So, two questions you should always ask. This is one of the most important things that you should keep in mind. If you leave with anything today, let it be this. The first question that you should always ask is, what data trained it? And over here, we're referring to the model. And then, was it tested on external data? So, number one question, what data trained it? This is really important, because it really matters what the demographic is for the data that is that is used to train the model. So, for example, if we take internationally recognized models, most of these models are usually trained on people based in America, in parts of Europe, in other regions of the world compared to where you and I are from. I am originally from Pakistan, but I've been brought up in the UAE. So again, we come from an entirely different demographic of people, and there's a lot of environmental factors. There's a lot of external key factors that really go into that decision making. So it's really important to know when you look at a model, or when you decide to choose a model, what data was it that trained the model? Because again, it's really important to know the demographic of the people, because the patterns aren't the same across the globe. So it's really one of the most important things. There needs to be diversity. There needs to be diversity in the data that trains a model. And then, was it tested on external data? Like I said, usually validations tests, or like on validation stages, models will perform really well. But what is the real test of the model is when it's tested on external data, one that it's never seen before. And that is what really tests the quality of the data. Any questions so far? It is very impactful, but don't you? I think that's an older one. Personally, I think healthcare professionals would not and cannot be replaced by AI. 100% agree. So it couldn't be a threat to any medical practitioner. Instead, we should see it as an aid to make some work easier. I completely agree with Miracle. And also, just for a little bit of heads up, the previous slide that I showed in regards to, oh, where are we? This slide, this is released by Anthropic, which is the parent company of Claude. And this is a company that is trying to sell you an AI model. So a lot of this is just them boasting themselves. So this isn't something to be scared of in that sense as well, because again, an AI model company, a company that's trying to sell you an AI model is definitely going to claim such things, right? And any more questions so far before we move on? How to determine what data was used to train the model? That depends on how the model, basically, whoever created the model will be able to tell you what data it was trained on. So usually if it is associated or affiliated with a research paper, you should be able to tell what data it was trained on, and it's usually a publicly available data set as well. Can you explain further on the external data part? Kind of a bit lost. Okay. External data. uh, external data. External data is, again, data that the machine learning model has never seen before. So we have the training phase, the validation phase, the testing phase, all of that. Leaving all of that behind, we have another patient that comes in, and we have data that we have never seen before. The machine has definitely never seen before. So we are going to test it on that external data. Was it trained on any? Was it tested on any external data in order to truly tell whether it is a good model or not? So how do you find the kind of data that was used to train AI? Usually, a lot of the models are going to be affiliated with a research paper, like I mentioned, and usually in the papers, they tell you what data it was trained on. So personally, the work that I did was trained on a Kaggle. Kaggle is a very popular online site for finding data, and that is what most researchers start to train their model on. And then from there, they can go on to collect data from real hospitals, actually. So that is something that will be associated with that. Where is the publicly available history of the data kept? History of the data might not be available, but again, if you are using a clinical or a medical AI, it is likely going to be affiliated with a research paper, and you can go ahead and look at what data. What is the aim of testing it? Of course, okay. What is the aim of testing it? The aim of testing it, there is no use of creating a model, training it, validating it, if we cannot use it in real world clinical settings, if we cannot use it to support clinical decisions. So the aim of testing it is essentially to not validate, but to test whether it actually works or not in a real world setting. So we'll have a doctor that will already know what the outcome is, but we'll try to use the model to see how accurate the model is and whether that task can be delegated to the model or not. So it's just going to enhance or test its capability. The site I mentioned, I'm going to go ahead and reply here. Kaggle, Kagglle, sorry. I just replied to you on that. I think for clarification, if it is a medical model, the external data should also be medical data. Yes, the external data will be medical data. I didn't realize that that is what you were asking. Otherwise, your model will not recognize the data it's testing. The model, in general, should not be able to recognize the data at all because it is external data and it is data that it has never seen before. But it should be data of the same nature. So if we're talking about X-rays, it should be an X-ray. If we're talking about PET scans, it should be a PET scan. And CT scans, it should be a CT scan. I think that answers all of that. Can you explain? Yep, I think that answers all of it. Any questions so far? If you want to ask, go ahead and raise your hand and you can unmute yourself and ask whatever it is that you want to ask. All right, moving on. Augmentation mindset. I'm gonna get rid of these lines again. So sorry, these bother me so much. But the augmentation mindset is essentially augmentation by definition basically just means that you're using something to enhance the quality of something else, right? So augmentation basically just means that you're using something to enhance the quality of something else. So look at you and AI as a pair as augmentation, right? So instead of looking at it as a threat to you or your career, look at it as something that can help you and that can aid your learning, your profession, your clinical decision making, instead of something that is capable of replacing you. So automation is something that can replace tasks and not professions. Examples of this will be a lot of people, when we had the advent of a calculator, a lot of people said that mathematicians would be replaced, but that wasn't the case. A lot of people said that with tractors, farmers would be replaced, but that wasn't the case. But this is something that is part of human nature, and every couple of years, every now and then, you will see that we advance in technology in one way or another, and it will never ever replace professions. It will just replace some form of task, right? So in medicine, you'll say that documentation, image triage, which is basically just prioritizing which patient to give priority to, literature search, these all are tasks that you can automate. And then therapeutic relationship, of course, the relationship that exists between a doctor and a patient are things that cannot be replaced, number one. Then we have ethics, number two, complex communication. That is something that AI can never, ever replace. And then from there, rare disease recognition. Like I said, for diseases that we don't have sufficient data available, that is something that AI will not be able to take over. That is something that only a doctor can recognize, only a radiologist experience or average radiologist can recognize. So these are all things. This is just to highlight the scope of what AI is capable of doing and what is still going to be in your hands in the years to come. Now, I want to ask two questions. You can leave them in the chat. What exactly is it that you think AI can do better than you? What exactly do you think is repetitive in your profession right now? And what do you think it cannot do better than you and will not be able to do better than you? How can you position yourself ahead in this AI era? In my opinion, the more you shy away from it, the more you run away from it, and the more you let it scare you, is the worst thing that you can do for yourself. The more you expose yourself to it, the more you start integrating it and understanding what exactly is the scope of artificial intelligence in your profession will allow you to truly understand what are the skills that you should focus on, and what are things that you can delegate to AI instead. So really experiment with AI as much as you can, and then from there, you can recognize the skills that you should be able to focus on as a human being. It can do good analysis, but it can dispense the knowledge I have gathered to the patient. Once again, brilliant example by Sam George over here. It can do good analysis, but it can never replace that large amount of data or the relationship, the medical history, the family background, the environmental factors that come into play. That is something that AI cannot do. It cannot show compassion like a human being. Again, doctors are one of like the biggest professions where compassion is extremely, extremely important. And that is something that AI can never replace. It can never show compassion because as a human, you can understand what another human being might be feeling. And that is something that AI will never be able to replace. These are brilliant answers, by the way. Yep. In automation, there's a lot that AI can do in terms of delegation. So again, it can free up time for you. So instead of focusing on repetitive tasks, you can focus on something else that you're passionate about, or research work that you want to do, or establishing relationships with your patients. But personally, I think these are amazing questions. Amazing, amazing questions, right? Uh, Amazing answers to my question. Sorry, I got distracted. Two, it lacks emotional intelligence. Once again, emotional intelligence is something that AI can never ever replicate. It is something that is embedded between you and me, but it is something that AI can never replicate. Right, moving on. LLMs, these are some things that you probably have heard of in the past couple of years. LLMs are essentially large language models, and these are models that are trained on large and large sets of textual data. So previously we discussed in medical settings, the likelihood of you training data would be primarily in imagery, as primarily in imagery of X-rays, as well as PET scans and CT scans and stuff like that. Those are some things that are really going to be important. But LLMs is also a really important factor. And this is where you can delegate tasks truly, where you can draft notes, you can summarize records. Instead of going through all of the details of a patient, you can go ahead and summarize it if it's readily available to you. Explaining medical terms are extremely important, especially if you're as a junior doctor, if you're trying to talk to a person who wouldn't be as familiar with medical terms. It is something that people might struggle with because you are so used to those terms that you cannot simplify it any further. So simplifying the concepts will be really helpful that AI can allow you to do, and particularly LLMs. And supporting clinical education. Again, education is a big part of where you can leverage it, but it really does matter how you do it. If you allow it to take over your entire cognitive ability, like somebody mentioned, it'll make you lazy and it'll really take away from you instead of giving to to you. So it's really important that you don't allow AI to take that part away from you, because education is a really important aspect of becoming a doctor, and it is inherently what is going to make you as skillful as possible. And then considerations that you need to take. Bias. As I mentioned previously, it is really important to understand the model that you are using, the type of data that it was trained on. So if you use a model that was primarily trained on white people, or and it wasn't at all sorry, it wasn't at all trained on people of color like you and me. If it wasn't trained on that at all, that is what we call bias. And a machine or a model cannot be biased. It is the people that train it, and it is the data that is provided to the model that makes it biased. Again, don't look at a machine as a human being or a living entity. It is something, it is as much as the human allows it to be. So bias can be introduced in models if it has been trained on a less diverse set of people. Then we have privacy. Again, not everybody, when you use an AI model, you are also indirectly training it. You're helping it become better. So it's really important to keep privacy factors into mind. And then we have consent. Again, when you're using or you're disclosing details of a patient, you want to make sure that you have the proper consent. The next thing is super, super important, in my opinion. We have accountability. Accountability is really important because a machine can never be held accountable. So if a machine can never be held accountable, it shouldn't ever be allowed to make the final call or the final decision on your behalf. It's really important that you keep note of how accountability, who the accountability lies on. So as a clinician, as a doctor, the accountability will always come back to you. So it's really important that you check the information, you verify the information, and you make sure that the decision that you're making is critically your own, right? And then hallucinations. This is something that you might have experienced interacting with ChatGPT or Claude or Gemini or whatever the model is. Hallucinations is basically when a model loses context. So basically what happens is that it forgets the context of previous conversations. Like I said, it is not good at retaining that information about medical history or family background and stuff like that. It is not capable of retaining it in its memory. So that is something that you will have to sort of rely on your own intelligence tool for this, right? Now, prompt engineering in clinical practice. This is from a paper that was published for a health uh, federal health thing for the US. Prompt engineering is essentially the process of structuring a prompt. And prompt engineering is important because an AI model is only as good as the prompt that you provide to it. So the quality of your output is directly proportional to the quality of the input that you give to it. So you want to make sure that you have a really, really good prompt, and that will directly affect basically your output that you get or the outcome that you get. This is an excellent paper. Again, you will be getting the deck. So this is a paper that you should come back to if you want to learn a bit more about prompt engineering, but I'm going to quickly cover what exactly it means. I'm going to go through the chats really quick. Any questions so far? Source of the material. Again, on privacy, yeah, personal information to AI. By privacy, I mean, of course, not personal information as in you might need to provide demographics for for whatever reason, but you shouldn't provide your name, your address, where you live. All of those things are very, very confidential, and those aren't things that can be used against you because you never know what it is with AI. Navigating the transition from intensive. Perfect. Okay. Any more questions? Source of the material, it is at the bottom of the site, and the sites will be shared. DOI again. Again, this will be shared to you. So this is an outline that you should try using for writing a prompt. There are three things that you should focus on. The first is the task, the second is the audience, and the third is the output. The task is basically what you want it to do. So what is it that you want it to do? Do you want, ideally, you wouldn't want it to make the diagnosis for you, but you can ask it to generate follow-up questions, or ask it to tell you what are relevant family history that could matter in this scenario, or what you could ask it to summarize a patient's medical history. Stuff like this is really how you define a task. Then from that, you want the audience. Who is it that you're trying to explain it to? Because the better you prompt it, the better you try to explain to it who you're targeting with this particular prompt, it will really help with the outcome. So, an audience, are you trying to talk to a person who isn't familiar with medical terms? Are you trying to talk to a fellow doctor? Are you trying to talk to a junior doctor or a senior doctor? Who is it that you're trying to talk to? And then from there, it'll be able to give you the particular outline or the guidelines or the language in which it is appropriate to communicate with that recipient. Then from there, output is also something that you should always ask for. You want a structured summary, you want a list of recommendations, a narrative explanation. All of these things are really, really important because if you give these three things to an AI model, it'll know from start to end what it needs to do. If you avoid giving all of these things or all of these outlines, it'll go ahead and start hallucinating, like we previously discussed. It'll not know what to do from there and it'll lose context. Yep, those are all LLMs. An example of such a prompt would be as follows. A clinician aims to generate a discharge summary for a 60-year-old male hospitalized with community-acquired pneumonia, including hospital course, discharge medications, and follow-up instructions, according to 2019 American Thoracic Society and Infectious Diseases Society of America guidelines. So over here, we have very clearly asked it what we want, what the output is, which is discharge, generating a discharge summary. And then from there, we've already told it what is the type of audience that we're targeting. Over here, it is a 60-year-old male, right? So for older generation, it is very important to sort of emphasize on follow-up instructions. So that is definitely something that the AI will know how to emphasize on. Or if it doesn't, then that's where you come in, and that's where your intelligence comes in. Another format that you can use for creating a prompt is what we call the care checklist. And this is when you have the context, you ask specifically, you review critically, and review critically, I will say, is the most, if not like it is the most important thing that you can do. So you should always review, you should always fact check, you should always check with the sources because AI does have the tendency to create its own sources. Like I have had personally a lot of instances where AI came up with resources. So you should always fact check. So the first thing that you want to do is provide it with context. What is it that we're trying to solve? Who is it that we're targeting? In my opinion, the previous framework is better, but this is a good guideline to abide by as well. So after you ask specifically, you want to review critically, and then from there, you also want to escalate it to primary sources. You want to fact check or cross check with the sources to make sure that what the AI is telling you is actually factually correct. So I'm going to give you a couple of examples, and then we're going to go ahead and try to do prompting in an AI model that I think would be good for this particular instance. So can you tell me what this patient has? Instead of just providing it a bunch of medical jargon, and then from there, just asking it point blank, can you tell me what this patient has? This is much structured prompt. We have, you are helping a junior doctor in an outpatient clinic. A 42-year-old man has 5 days of fever, dry cough, sore throat, and mild shortness of breath. He has no chest pain, no known asthma, and a normal oxygen saturation. Give me a brief differential diagnosis, the three most important red flags, and what additional history I should ask next. Do not give a final diagnosis. Again, it is very important because sometimes it can sort of mislead you. So try to make sure to add this at the end. Do not give a final diagnosis and try to make that decision by your own critical interpretation of the symptoms as well as the reasoning that the AI model gives you, if it is that you're using a reasoning model. Another example would be summarize this case. Instead of saying that, you should rather ask, summarize the following clinical note for a busy clinician in 5 bullet points. Include diagnosis, key exam findings, treatment given, pending tests, and a follow-up plan. Keep it concise and do not add anything that is not in the note. This is, I think, a really, really important phrase that you should practice adding in your prompts because, again, I have personally first-handedly experienced AI models just coming up with papers that do not exist. So it's really important that you fact check and also concisely ask for it to be limited to the data that you provide to it. Another example, explain this condition. Instead of saying this, instead of just blatantly asking for an explanation, explain this diagnosis to a 55-year-old patient in simple English at a reading level a non-medical person can understand. Again, this is for if you have enough experience in the field and you at a certain point, like for me as well, like I cannot sometimes or oftentimes I cannot dumb down technical concepts enough, and that is where AI can really help you. It can really help you simplify the concepts or the diagnosis that will help the person that is sitting in front of you understand it in the capacity in which they're able to understand. So over here, we have the prompt which says that explain this diagnosis to a 55-year-old patient. We already went through that. Avoid jargon, keep it under 150 words, and include one sentence on why follow-up matters, right? This is another example. You can go through it yourself. And then from here, I think we should move on to the hands-on activity that I have for you guys today. The model that I'm going to be using today is K2 Think AI, and this is a model that was trained at a local university in the country, but I am not affiliated with the model in any way. And it's just a really, really good reasoning model, and you're able to trace the steps essentially of the AI model. So it's really, really helpful, especially as a doctor, for you to trust what the AI says. So we're going to go ahead and go through these prompts, and we're going to try to put them into the model and see what output we get. So I'm going to go ahead and share my screen for that particular tab. You think this, are you able to see my K2 Think? This tab? Yes. Okay, perfect. Now, I'm just going to go ahead and paste this prompt. Again, we need to follow a particular framework. It doesn't matter what framework you follow, as long as you have all of the information that the AI model might need. So rewrite this for a patient and family member in simple language. Here, we're clearly defining what output we want and what is the audience that we're targeting. A 62-year-old woman has been diagnosed with type 2 diabetes with several months of increased thirst and frequent urination. Explain what the diagnosis means, why follow-up matters, and what lifestyle changes are usually recommended. Keep it under 150 words and avoid jargon. I'm going to let this work, and if you have any questions, just go ahead and drop them in the chat, and I will keep an eye out. As you can see, we can see the entire process of the AI model thinking. We have the entire reasoning in front of us. So over here, it starts off by dictating the question back to itself, right? We must ensure to comply with the policy. It's medical content request. It's permitted because the user is asking for general medical information and not medical advice. This is allowed. I'm going to go ahead and send the link to this AI model so you can go ahead and practice some of these prompts yourself because I think it's one of the best reasoning models, especially if you're a doctor and you don't want to trust AI models. It can give you like a clear outline of what it is that the model does or how it should things. Yes, I just sent a link of the model in the chat. Have you guys received it? I'm gonna send it again. Are you seeing it in the chat? Okay, perfect. So from here, what we're seeing, diagnosis means let's keep it under 150 words, and then word count. And then from there, potential rewrite. This starts with a first rewrite, and then from there, it'll go ahead and count the words. So you're going through the entire reasoning process with the AI model. And I think it's really, really important to understand the reasoning behind an AI model. It's really important to have explainable AI in medical settings because it really helps you understand and why any factors that the AI might have missed. And then from here, we can go ahead and try another form of prompt. And I will actually drop this in the chat as well. So you can go ahead and try to follow along with me. And then you can also try to come up with your own prompts. You can go ahead and follow the outlines, one of the outlines that we're discussing, and then from there you can go ahead and structure it in a way that you think is best. And then from there you can see how well the AI model behaves, and from there you can decide whether you want to trust it or not. Right? So, for instance, over here we have the we require 5 bullet points. We have it basically understanding what are the 5 bullet points that are required by the prompt, and then from there it is checking the constraints. As you can see over here, it is literally going through all of the constraints that we added. Do not add anything stated. So over here you can see that it isn't going to hallucinate or add anything that it shouldn't add. And then from there, it gives you the final outcome. You can directly skip to the outcome, but if you want to go through the entire thinking process, as you can see, it can be really helpful to understand how that output was reached. If you want to try a couple other prompts, I will go ahead and go through this as well. We have this prompt. This is for a junior doctor. I'm going to go ahead and paste it over here. And as you can see, it does the same thing over and over again. And it's just helping us in a really, really good way because we can track the reasoning. And again, one of the most important factors for clinical AIs is the reasoning model, because most doctors will not tend to trust it unless they can see the exact mapping of the entire uh, thinking that the AI model does. I'm going to go ahead and send this as well. You can go ahead and add this, and then you can use your own prompts, create your own prompts, and then test for yourself whether you like it or not. And then finally, to conclude, use AI critically, not blindly. AI is not something that will replace you. It is not something that can replace your critical ability. And it is really important that you recognize that and you leverage your skills as a brilliant doctor. And you can delegate tasks to it, of course, but you need to focus on becoming a better doctor by focusing on what matters more in the medical profession, which is establishing good relationships with your patients, understanding how to communicate diagnosis properly, how to guide patients, how to tell them or how to break down concept in simpler terms, and just all in all try to establish a good relationship with your patients in the medical profession, right? So that is all on my end. That is all I have prepared for you today. And from here, if you guys have any questions, I will open the floor for any of the questions that you might have and any clarifications that you might need. Go ahead and raise your hand and then or drop it in the chat if you're comfortable. Yep, it is definitely safe to say that, Emmanuel. An AI model, the way it behaves is only going to be as good as the prompt that you provide to it. And it's really important that you structure your prompt properly in order to get the best outcome possible. Great. Thank you so much. Thank you for attending. Any questions? You can go ahead and unmute yourselves. Feel free, and I will answer the questions to the best of my ability. You're welcome. You're welcome. No questions?
If you have a question, you can just indicate by raising your hand, or you can ask on the chat box. While we are doing, okay, there is a hand already. Okay, again,
What do you mean?
you wrote, let me unmute you.
Okay.
Okay, so thank you very much for this wonderful session. Okay, I wanted to ask for these AI models, is it possible that if um, it is wrongly programmed, maybe from the programmer, it could lead to like wrong results, like the hallucinations you talked about? Is it possible that it could be as a result of wrong data that has been imputed into like that have been presented to the AI model? That is my question. Thank you very much.
Yeah, but there are a lot of instances where again, like I said, when you use an AI model, you are also indirectly training it. So there have been instances where an AI model has been misled because of the way people tend to interact with it. And it is very, very much possible that an AI model can be wrong and treated on the wrong data if that is what it is exposed to. And it's really important that you fact check. As I mentioned previously, it is something that you should always fact check, especially in a profession like medicine. It is really important that you fact check everything because it is a human life that we're dealing with. Great question, by the way.
Okay. The next question from Idijana Deborah. You can unmute now.
Okay. Thank you for the opportunity. I hope you can hear me.
Yeah, I can hear you.
About the emotional aspect of AI, I wanted to ask because now we see people creating emotional attachments with AI, especially ChatGPT, for example. A lot of people feel like ChatGPT is their personal therapist, something like that. So I wanted to know more about that.
Yeah, I mean, it's just a matter of the human relationships that exist around certain people that they have to turn to a literal bot to validate their feelings. I think that that is an issue that needs to be worked through. But AI, usually people turn to ChatGPT because it is the type of model to validate your feelings as much as possible. But I don't think that that is healthy at all for your own mental health. And you should definitely avoid disclosing your feelings or your emotional state to AI models. That is not good for you, and that can definitely be used against you. Always use it very, very in the safest way possible. And also, I saw a question in the chat. What do you mean by using AI critically? By what I mean by using AI critically is that you shouldn't just blindly rely on the answers that AI gives to you. So if you prompt it for a diagnosis, for instance, instead of just going ahead and believing whatever it tells you, you need to fact check it with research work, with your senior doctors, with whoever you have available. It is very important that you fact check it because, again, it is not something that should be trusted blindly. It is, again, artificial intelligence. It cannot replace your own intelligence. I'm going to take a couple more from here. The choice of the model to use, does it lie on the clinician or the programmer? Models can be of different natures, but clinicians tend, as a clinician, you can decide what model it is that you want to use. How do you ensure the adoption of these models both for clinicians and for patients? The way that we're, as researchers, trying to have adoptions of models is by integrating, like I mentioned earlier, we're trying to integrate explainable AI so that you can see the whole reasoning process of the artificial intelligence model, so that you can understand what the thought process or what the reasoning is behind reaching that particular conclusion. Can you suggest a medically based AI for us as doctors? I saw Avadoc as a sponsor of this boot camp as well, and I think Prosper mentioned that it is a really, really good clinical AI that is based in in Africa. So I think that that is something that you can try using. And then, the model trained on African medical data? Unfortunately, I do not yet know of any model trained on African medical data. Does this mean that the privacy of such individuals are at risk? This is a good question. Privacy is at risk if you're on the internet. Your privacy will always be at risk because of how interconnected this is and because of people that try to make malicious attacks on data and try to misuse it. So there is a risk pretty much everywhere, not in particular with AI, but with technology in general. But it just depends on who it is that is using it. Based on my interaction with AI so far, I feel like they're made to support your perspective, sound like they're trying to say what you want to hear, even when they ask you. I definitely agree. This is because of the data that it is trained on. And I would highly suggest that you use Claude because, in my experience so far, Claude hasn't been the sort of yes man that ChatGPT tends to be. And Gemini, I will say, is in between, but ChatGPT is definitely a very big yes man and it will agree with whatever it is that you say to it. Claude has a little bit better reasoning. And I think that that is an AI model that you should look into if you've been struggling with an AI that will always support your notion. Is there an AI that fact checks other AIs? Great question. not that I know of. Medically based AIs for us doctors. Again, Avadoc, like Gift has replied. What do you mean by using AI critically? Again, using AI critically, don't just trust the output that it gives you. Fact check it, understand it with whatever experience that you have. The people around you, leverage the senior doctors that you have around yourselves, and take their advice for it as well. And don't just use it blindly. Don't just trust whatever it gives, whatever outcome it is to you. What of the age restrictions on Claude? I think it is 18 plus. My sister is 16 and she wasn't able to make an account on Claude. So if you're under 16, you're already way ahead of your peers because you're attending this boot camp, but that is the age restriction. What do you think about Grok? It's terrible. Attendance, formal video. Okay. Any more questions? Let's go back to unmuting. Please, I cannot pronounce your
I
name, but
think John Hui, you can speak now.
Okay, hi, good evening.
Good
So I have
evening.
a question, and my question is, you mentioned something about privacy, right? So say I'm using ChatGPT for instance, and then I give it a prompt that involves my information, right? And it works on it. You said machine can learn from data, right? So does that mean that maybe if I put in a data that ChatGPT could learn from, can it also use that same, maybe it learned from my data now, can it still use that knowledge it got from my data for another person? Meaning, does ChatGPT keep privacy of maybe conversations between me and it, or it can also use data from our conversation for another conversation or for something else?
By that, what I meant was I should have been more clear. But when you use an AI model and you train it, it's basically based off of your feedback, but also your data is being collected. So it is never ever a good idea to leave personally identifiable information in your chat with AI. So always make sure that you're not disclosing your identity in your chats, and always make sure that you're not disclosing anybody else's around you identity either. So that's really important. But I don't think it will disclose it to someone else. Like I can't go into ChatGPT and ask it what my neighbor is trying to use ChatGPT for.
Okay, thank you.
You're
Okay,
welcome.
Miracle Agbo, Ugu rather.
Okay, thank you very much. Good evening. My name is Miracle Ugo. So I have a question.
Mm-hmm.
I would suggest, can you hear me?
Yeah, I can hear you.
Okay, thank you. So I would suggest three apps, and I want you to tell me the AI that's actually best for medical students. So there's ChatGPT, there is Gemini, and then there is this Our Doc. So amongst these three AI, which one is more preferred for a study?
What was the second one that you said? You said Gemini?
Yeah, there's ChatGPT, there's Gemini, and there's Our Doc.
Okay, great question. Personally, I haven't used Avadoc because it is something that is based in Africa, and I think it is restricted to that region from what I know. But I would suggest that Gemini is a really, really good alternative to ChatGPT based on my personal experience. When AI initially started, I used to use ChatGPT a lot, but I don't think it performs as well as Gemini does or as Claude does. And for medical data or for understanding medical medicine or studying medicine, I would highly suggest using Gemini if you are only restricted to those three. But I think a really good alternative would be Notebook LLM. And this is a form of an AI model that you can actually use. You can upload your own notes, you can upload your textbooks, your uh, presentations, all of that data that you want to learn from, you can upload all of that onto there. And then from there, you can go ahead and ask it questions in regards, and it will answer based on the context that you've given it. So if you're a student and you're learning, I would highly, highly suggest Notebook LLM.
All right, thank you very
Okay.
much.
You're
Adding to
welcome.
that, Miriam, adding to that, our dog actually isn't a large language model. It's actually basically a chatbot, which as we progress within the week, we'll get to know what our dog is in better context. So it's a chatbot a medical chatbot that medics, whether you're a medical student, every human being can actually use our doc. It's just bringing the hospital to your device. So it's just like your medical assistant that follows you up, helps you out in booking what's it called? If there's a need to be referred to a doctor, you're being referred to a doctor, he's just acting as your doctor in your home. So that's what our doc basically does. So as we progress within the week, we'll have more clarity as to that. Still on that, call me Jakes. Okay, before that, Miriam, I think there are some questions on the chat box. You could just attempt those.
Yep, of course. And also, there's a question here. There is no AI model that contains information from Africa. I did not say that. I said that I don't know of any. But there definitely probably are, and I think that, you should definitely do your research for that. But usually, when we're trying to create models, we're trying to collect diverse data. So you should definitely look into the type of data that the model is trained on. Call me Jakes. You've had your hand raised for a while. Do you have a question? Avadoc has an app. I think Avadoc is a WhatsApp chatbot from what I've seen and from what Prosper just mentioned. It is a WhatsApp chatbot. Yes, Jakes.
Yeah, good evening, everyone. My name is Debo Jacob. I hope you can hear me. Yeah.
Yep.
So my question is on the machine learning. In case you want to deploy an AI tool, which is deployed for your area, at what point will you say that you've trained it well? At what level of um, data will you say that you've trained the AI enough? And the second question too is, in case the data that you have is very limited, like you have only a data set with only 500 data variables in there, can you still use it to train an AI and deploy it for it to be adequate or standard to use? That's what I want to ask. Thank you so much.
Okay, amazing. Great questions. For your first question, there isn't a set amount of data. It really just matters on how it performs in the validation stage and in the testing stage. So there isn't a set amount of data. And a lot of the training that I have personally done has been with 100 over, a little bit over 100 data points. So 500 is a very, very good number in order to train it, given that the nature of the data is an image. I think it would be enough. If you're training a smaller model and you're trying to target a specific demographic, then I think 500 is more than enough. And the first question was, okay, I'm losing track, sorry. First question was, how much data do you need? It depends on the validation metric. The second question, 500 images is more than enough. Melinda, please go ahead and unmute yourself. If you have a question. Or Doxa.
Okay, good evening.
Good evening.
Good evening, everyone. Can you hear me?
Yep.
Okay. My question is, recently I was talking with a friend and then he sent me a link from Anthropic to a list of Anthropic's cloud courses on AI and stuff like that. So I wanted to know what among those courses like would be like the best to start with for as a medical practitioner or someone in healthcare that will also help our knowledge in the use of AI.
I think the courses are pretty short. I think Anthropic has one of the best models in the market. So if you have the time, I would really suggest that you do all of the courses if you're trying to use Claude, because all of those really help you understand how to use Claude to the best of its capability. So if you do have the time, I would say do all of them. I don't know precisely which courses exist within that, but I do know that they're really, really helpful and they are free of cost. So for anybody who wants to learn more about AI and more about Claude in particular, I would highly suggest that you complete those courses. But on that
All right.
note, I
Thank you
will
very
say that the best way to understand how to use AI is by doing. So don't just do courses, because courses can become a waste of time if you're not really learning how to implement it. So do pair that textual learning with, or like that video learning with learning or actually using it in practice. And that is, I think, more of an all-rounder. It isn't specifically for medicine. If you want to learn more about how AI models are trained in regards to medicine and computer vision, I think it's the best bet that you could have is by reading research papers. There's a lot of research, and in particular, there's so much research on breast cancer because of the abundance of data that we have. So if you want a starting point and understand AI and just explainable AI in general, I think those research papers are a great starting point. I hope that answers it.
All right. Thank you very much.
You're welcome.
Yeah.
Clinton, Ikpenu Clinton.
Okay, good day.
Good evening.
Hello, can you hear me? Good day.
Yes.
Okay. So I wanted to ask, I didn't hear you mention anything about Hugging Face.
Yeah, I did not mention it.
Build on
Hugging
already
Face.
existing data. So one wants to build on an existing data set, or using some offline GPT models or Gemini models, and then using something like Skitlane or TensorFlow. That's in case of building. But the already existing local hosted models, and then putting maybe some medical could be reduced, and also medical validation could be implemented. So that's my question. I don't know if you got it.
Me personally, I haven't really used any of the models on Hugging Face, but I've heard a lot about it. And if you want to do, because those are a lot of terms that medical students, I wouldn't assume that medical students know. So you're heading down the right track. So definitely, if you want to do it, you can do your research on it, and you can use the models that are available on Hugging Face. Muhammad Mustafa Musa.
Hello. Yeah, can you hear me?
Yep.
Yeah, good evening. Thank you so much for the session. I just wanted to ask, recently I've been trying to, because I thought initially, because I've been using, ChatGPT since it came out, I thought initially that I was some sort of a prompt engineer until recently I started using Claude actually earlier this year. And I found out that, there's a lot more to it. There's Claude Code, there's Claude Cowork, and you reach the level where you're building AI agents and so on. And so, what I have two questions, I guess. Number one is, what can I do to, to become a better prompt engineer, to scale up my level? Okay, not just typing in prompts into the prompt bar. And secondly, I remember asking Claude to make me a full roadmap to, upskilling myself in terms of the knowledge. And it recommended, I learned things like Node.js, JavaScript, Cursor, and so on. But it did not recommend Python. So do you think Python is it not important in a journey to learn surface level knowledge of how to make an AI agent?
Really sorry, but what was your first question? I lose track really easily. I remember your second question, but what was the first question?
Yeah, my first question was basically, what can I do other than what I've done to become a better prompt engineer? And yeah, that was the first question.
Okay, perfect. Okay, so for your first question, to become a better prompt engineer, there's a lot of courses that you can do on Anthropic. There's somebody mentioned the free Anthropic courses that are available. I think that is a really good place to start. But again, as I said, it's the best way to learn is by doing, and the only way you're going to get better is by doing. So make sure that you allocate most of your time to doing rather than learning, because my dad, something that he points out a lot is that he's done so many courses, but he never knows how to really implement them because he's never tried. So it's really important that you pair courses with learning. So for prompt engineering, I think structure is extremely important. So understand the outline in your particular field. Just understand what outline it is that you should follow, and then from there go on to structure your prompt the way that is best for your work. And then for your second question, I personally have been using Claude Code a lot in the past couple of months. I think it is incredible what you can do with it. A lot of the research papers that I've read and the research that I participated in as well used Python, and I'm actually teaching Python for an online course as well right now. And I think Python is really, really good. It's a really good starting point if you're trying to focus on modeling or machine learning, and that is like your focus. I think you should start with Python if that is your focus. If application building, web application building is your focus, then that would be where you would bring in Node.js or those other programming languages. But I think Python is really, really good. It has a lot of inbuilt libraries for machine learning, like somebody mentioned. There's TensorFlow, there's scikit-learn, all of these libraries that you can leverage to your advantage. You can go ahead and use these for modeling and model training. I think it is still very, very important and is still somewhat in the lead for machine learning. And I think Python will not be dying anytime soon.
So, ma'am, if I understand you well, you're saying that a person that wants to learn how to train models cannot do without Python.
I wouldn't say you can do without Python, but I also haven't seen any coded models built without Python. That's what I'm saying.
I see. Okay. Yeah, thank you.
You're welcome. Benedict.
So I think that's more of it from the call. So before we call it a night or a day or a morning or whatever from your location, let's just give a round of applause for Mariam. This was a massive one, honestly. Like she really did so much in this little time. Let's go ahead. Yeah. Thank you so much, Mariam, for this session. I'll be
Thank you
honest,
for
I
having
didn't
me.
expect it to be this massive, honestly, but you really did so much. Thank you so much, everyone, for connecting for this particular session. And would continue tomorrow. Tomorrow's schedule will be sent on the group chat. It's already there, but it will still be shared again. So thank you so much, guys. And if you've not filled the attendance, please do so, so you don't miss out on what it's used for. So thank you so much, guys. I think we
I
can
think
give.
Benedict had a question.
Yeah.
Can I just quickly take it?
Okay.
Good evening, Mariam. Good evening, all. My
Good
name is
evening.
Benedict Alum. Like the previous student said, he made mention of using Cloud Code to support coding. But Cloud Code, I didn't see any version of it that supported Python coding. What I just saw was VS coding, but not Python like Jupyter Notebook. So is there any other alternative that could help in assisting learners of Python in coding? Thank you.
If you're trying to learn Python, I would say that you should focus on exhausting your free resources first. So YouTube tutorials, online courses that you can find for free. So make sure that you're focusing on free resources before you move on to paid resources. But I think the free resources are one of the best that you can do. And if you're interested in particular in learning Python, Stanford does this course once a year. Since COVID, they've been doing this course once a year where they teach Python to beginners around the world. So it is remote. You can do it from anywhere in the world. You can volunteer to teach. I volunteered to teach this year, and you can also You can volunteer to be a student, and they teach you the fundamentals of Python. If you're experienced in coding, I wouldn't say it would do you any good, but I think it is a really good starting point if you have, if you don't know anything about Python and you'd like to get started. But the one drawback would be is it only happens once a year, and it's gonna start next year in April for the next cohort. So definitely use YouTube and all of the free resources that are available on the internet in order to understand Python.
Thank you.
You're
So,
welcome.
Miriam, just take the last question. So just end it there.
Okay, of course.
Solomon,
Solomon, let's take the last question from you, and then we will call it a night.
All right, thank you so much, Miss Miriam. Yeah, so my question was I actually sent it on the chatbot, but I guess it wasn't taken. So I was asking, how do we balance the usage of AI such that it doesn't affect our critical thinking and or cause over dependence, saying that it could be since it's easily accessible, how do we balance its usage so that it doesn't affect our critical thinking and even our human judgment?
Okay, great question. I would say once again, it is this entirely depends on you as a user, how to what extent you allow yourself to consume it. So if you're a student right now, I wouldn't say I would highly suggest that you don't use it in a sense where you're letting it complete your assignments or solving exam questions for you or stuff like that. It's really important that you know your limitations in that sense, because it's really important to as a student, because you're paying to get your degree. If you let AI take over all of the work and do all of the heavy brain lifting for you, you're going to leave with a degree, but you're never going to understand the fundamentals of medicine. And I think it's really important to set those boundaries. So use it to map out your learning, use it to understand what can be done in the field, use it for research purposes, but never use it for replacing your own critical thinking, where in areas where you can do your own research, where you can do your own research on papers, you can read your own sort of literature, anything that you can do on your own, try to do it on your own. Of course, there are some tasks that are repetitive that you can delegate to it. But again, this entirely depends on you and how you decide to treat the AI model. So again, don't let it replace you. So that'll be it for today. I am so glad that all of you guys joined, and I hope that you guys leave today learning something valuable, and this helps set a solid foundation for you to move on from tomorrow onwards. And I'm really grateful to UnboxMed for providing me the opportunity to speak, and I will see you sometime again, hopefully in the future.
thank you so much, Miriam. Thank you everyone for connecting. So we'll continue tomorrow for day 2. So we can leave the call now.
Just one more thing, everyone. The chat box is being open now, and so I'd love for you to drop your reviews from today's session. Just say something you have learned, and just let us know how the session went for you, okay? Thank you very much.